Hi, my name is Shelby, and I'm working with my partner Gabe, and we will be showing you how to measure blood pressure. And these are two pieces of equipment used, and this is the stethoscope with the bell, the diaphragm, the tubing, the stem, the ear tube, and the earpiece. And this is the sphygmomanometer, and this is the bulb, the valve, the aneroid gauge, the cuff, and the bladder.
Next, we will proceed to demonstrate how to take proper blood pressure. We can begin by talking about why taking blood pressure is important, and that is because if your blood pressure is really high, this could affect your arteries and narrow them and cause clots in the heart, which could lead to serious heart problems. As you can see, there has been a cuff placed on my right arm, and specifically on the brachial artery, which is used to take blood pressure. It is important that before any of this could take place, I myself or the patient will have to be sitting down or laying down in a relaxed position for at least 5 minutes. The the, the pumping should be increased by 20 to 30 millimeters mercury after the pulse can no longer be heard by the earpieces, and then from then it should decrease by 2 to 3 millimeters mercury per second to be able to determine the diastolic and systolic blood pressure, and also to release and pump the the cuff. You turn right to pump, and then left to release.
So after taking Gabe's blood pressure, it was determined to be 122 over 81 millimeters of mercury with a mercury sphygmometer, and also with that, a proper cuff size is important, and you determine that by the circumference of the arm. And at the end of the video, we will have a table that shows appropriate lengths and sizes of the cuffs. And the importance of pumping the cuff up so high is so that there's no pressure or no pulse detected, and then you can hear the Korsakoff sounds when the pressure is released for the systolic blood pressure number, and then as the decrease in pressure is continuing, you can then hear the sounds for the diastolic pressure.
And finally, as Shelby said, this was my measured blood pressure, 122 systolic over 81 diastolic millimeters mercury. And if you look at this chart right here, these are the values for normal blood pressure and the pre-hypertension and the stages 1 and 2 of hypertension. So based on my blood pressure, I would say I will stand in the normal ranges. And if you happen to come across any of these scores over here, you should get it checked out by a professional and get exercise.